All right, today's question is the question of the day is from Diane S. Hi, Diane. Oh, Diana,
Diana.
not Diane.
Yeah, let's be
Diana.
complete.
So 6 months ago, my 65-year-old husband had elbow carpal tunnel diagnosis that left his right hand so weak that he can't play guitar. His fingers are still weak, particularly in lifting the fingers up from a flat hand. Show what we think she means by that.
We're assuming this is...
Yeah, from a flat hand, she's trying to lift them up like that. It's like someone playing piano needs to do. He read once that once the strength is gone, it can't be regained. Not buying it. Can you help? So these are our thoughts. First off, if it was carpal tunnel syndrome, that would not affect the muscles that lift the fingers up this way.
Right.
It affects the muscles that bend the fingers.
Yep, grip.
Yep. So it's possible that because these were weak, maybe they tightened down a little bit. I don't know.
Right.
I mean,
we really have to do some estimating, some guessing without hands-on. But, you know, he mentioned about elbow carpal tunnel.
Oh, yeah, elbow carpal tunnel diagnosis.
Which is a little...
A good point.
Unusual because maybe there is a possibility of...
It was the ulnar nerve or something, or a different nerve.
Right. So, but I think either way, we're going to approach it with the same...
Right.
You know,
so
advice.
First off, it can take a long time to regenerate.
Right. If a nerve is damaged, take months.
Months. It can go up to 1 to 2 years.
Yeah.
So I certainly wouldn't give up after 6 months. I would definitely continue with it.
Sure.
The second thing is, Brad and I think you should stretch the hand, because maybe if it is tight, that's why you can't lift it up. Not as much that it's weak. So just want to show a stretching of the...
Right, so we want to maintain range of motion, and this is a very conservative, you're quite safe with this. So if this is the hand that's weak, you take the other hand, and I call it a mirror image, and then just simply stretch it. See, I'm pushing it this way. Gently stretch, just feel the muscle stretch, and then go back. So pressure on, pressure off. I call this the mirror image contact because the hands touch as if you're touching the mirror. And this is, do you have a different way to stretch?
No, I think that's great. And when you go into this position here, you can even try to hold it there.
Sure.
And then come back.
Yep, that'd be an eccentric. That would be that would be a nice way to do it. The other way, I would do this about 10 times. Pressure on, pressure off, that's 1. Do that 10 times. And then put it back on the table after it's stretched, and then see if you can do the lifting. And then do 10 repetitions of that. Even if you can just lift them off the table is a real good sign.
Any movement at all.
Exactly.
You can work with a rubber band too around it, but that's probably too much.
Yeah, this would probably be a great place to start for now.
All right, good luck, Diana.
Yeah, because we've got to keep people who can play guitars and get some music is just absolutely the most wonderful thing you can be gifted at.
All right, today's question is from Michael H. First off, sympathies for having the same first name as our cameraman. So let's talk about
Bob.
the question.
Why, Bob?
Hi, guys. You two are the best physical therapists on the internet, in my opinion.
Oh, thank you.
So he's buttering us up.
Yes.
He's 63. He still works. Good for you. I was wondering if my job could be causing my pain. It's right at the point in my elbow where the ulnar nerve is, which is, you want to show where it is, Brad?
Oh, yeah, sure. It's right there. It's right in the ulnar groove there.
Yeah, the medial nerve there, the medial aspect of the...
Right, not the medial nerve, but
not the medial nerve, right. Part of my job is to lean on the down on the forearm to clean parts. I have pain while doing this. It's also tender to touch. I wake up in the morning with pain while bending the arm. Could there be bone spurs in the elbow also? I don't know if there's bone spurs, but you could be developing like cubital tunnel syndrome.
Right.
But the big thing is you got to stop leaning on it. And Brad's going to show you a hint for that.
Well, the other thing is he mentioned, you know, his job causing pain. Well, a lot of people's jobs cause pain in general. So I suggest a new job. Just kidding. Just kidding.
No, he's got to adapt his job, though.
Right,
He's got to adapt the workplace.
Yeah, I just wanted to throw a sense of, I have. So I'm going to do it to this side. So if you're leaning on a hard table, let's say this is a hard surface, that's absolutely very common that ulnar nerve which goes right through there up into the hand, can get irritated and pinched.
We see it in patients when they sit in wheelchairs.
Sure.
All day long.
Exactly. So if you can get a cushion, this is actually a nice cushion. It may be hard to see on the video, but it's soft, it's squishy. You could use that. You could put your arm on there, or even that area, have it come off the edge so that it takes the pressure off completely and it goes on the forearm.
Come to think of it, with some patients, man, we put elbow pads on them.
Oh,
I mean, you can buy elbow pads.
Like a sleeve type of pad that come up.
Right.
And if that's, or a Velcro one, so you may want to take it on and off throughout the day.
Yeah.
If it gets too tight and then uncomfortable.
Yeah, that might be the easier suggestion because you don't have to pad that there all the time. So pad it up, and I'll bet you'll find out that nerve starts to recover and you'll no longer have any pain.
Exactly. Well, good luck with it, and thank you.
Michael.
We did good.
We did good. All right, next question is from MAX-CHRISTY R. So, hi Max. What we have here is, I'm waking up in the morning with my elbow hurting. What could be going on? How do I make it stop? I sleep on my side with my hand up by my face, so my elbow is bent. This is not new for me. So, first off, even though it didn't hurt before when you slept like that, it can definitely develop over time.
Do we have an age?
No,
Oh.
he didn't give an age.
Well, then maybe he wants to keep that private.
Right.
But yeah, I mean, or it could be possibly a mild case of tennis elbow or something like that. But when you're
irritating during the day and then the swelling at night, and it gets flared up.
And particularly if you're sleeping like this, your elbow is at what we call end range.
Yeah,
and
maximal flexion.
Yeah, anytime you keep a joint, doesn't matter if it's elbow, knee, hip, at end range or it's bent all the way for long periods of time, it's not uncommon for it to become painful, particularly if there's a minor secondary irritation. And then I'm assuming, I don't know this, but I'm assuming once you get up and you start moving it around, it feels better within the next half hour. If that's the case, you're going to need to change your habit sleeping, which is difficult, I understand, but get that elbow not at this end range, but straight or somewhere in between, using a pillow to prop at your side.
Yeah, maybe even two pillows.
Yeah.
Some people lay on their side and lay the hand along their body.
Sure.
Some people have a pillow they can hug?
Body
pillow.
Body pillow.
And some lay on the back with two pillows. It's an experiment. Or on their side with two pillows in front of them. You got to get that. Any joint does not like to be at that end. Like if you have your knee like this all night long, it would bother you. If you have your joint like this, if you have your neck one way all night long, it doesn't like it. So.
And as you age, it typically gets a little worse, and our body speaks to us a little more when we do those end range.
Yeah, you maybe got away with it before, but you're not going to get away with it anymore.
Yeah, that's right. That's part of life. So we really hope that this is helpful for you, and I think it's going to help your problem.
So do people call you Mad Max? I want to know.
Bob. He's
Max.
Probably a very pleasant person, and now what's he going to think of us?
Yeah. Okay, today's question is from Vicky J.
Okay, Vicky.
VJ. I don't know if I should say that. But anyway, the question is, I broke my wrist 4.5 months ago. I worked with an OT for about 8 weeks post-removal of the cast. I still struggle with supination of the affected forearm. Do you want to show that, Brad?
This way.
Yeah. And I've developed an encapsulated shoulder. Now, I think what she means is a capsulitis, adhesive capsulitis. A frozen shoulder, basically.
Right.
2 months ago, I continue my home program for the wrist, and I'm trying different exercises to unfreeze my shoulder. How common is a frozen shoulder as a result of a broken wrist, and when should I be concerned about lack of progress for both the wrist and the shoulder? Well, we're going to talk about the shoulder, because she's got exercises from the OT.
Right.
We don't want to try to usurp
right,
her
and if you're
authority.
having difficulty with supination, that's not uncommon.
Right.
I would, go to your
listen to the OT.
Yeah, because then they're already
they know what's going on.
They know the history, or she or he, and so anyways, let's go to the shoulder.
Let's talk about frozen shoulder, though. Yes, very common to happen with when something else has been damaged in the shoulder, or some trauma, some surgery. It happens quite often as that. More often in middle-aged women, and happens with people with diabetes.
You're not just making this up.
I'm not just making this up.
Okay.
We actually did as a part of this shoulder series, We are having a video that we talk about frozen shoulder,
Right.
how it happens, how to treat it. That'll be coming up within the next couple of weeks.
For those of you who have not, frozen shoulder is what we really call it in the medical field, although the technical term is
Adhesive capsulitis.
right. But Bob's going to talk about thawing and
Yep.
and that's actually terms that we use
Yep.
technically too. So
Yep.
we didn't just make this up.
So it's got, when you get a frozen shoulder, you have 3 phases.
Mm-hmm.
You're going to have the freezing phase. That's where it's starting to freeze. Very painful phase, by the way. That's the-
Temperature's got it just means it's getting stiff.
Yeah, it's getting stiff.
Mm-hmm.
Then it's called the frozen phase. Now there's less pain during that phase, but you have a total lack of motion
Right.
in all directions.
Mm-hmm.
And then there's unthawing phase. These phases all take a certain amount of time. Overall, it can vary from person to person, but it can take as long as a year and a half to 2 years. Now, frozen shoulder is considered to be what we call a self-limiting problem, which means a lot of times, even if you don't do anything, it gets better on its own.
Sure.
We recommend you do. We recommend you do the stretches.
Right. So it can accelerate the progress.
Right.
And you don't want to get things to lock up.
But to some extent, it's going to play its course. You know what I mean? It's going to take a while, no matter what you do. So even if you start, you're 2 months out. Let's say you start really hitting it. It still may take another year to get better. I'm sorry to tell you that, but that's just how frozen shoulder is.
But be optimistic. It may be better. Do your exercises, and we're going to have a video in this series
Yeah.
on
The
exercise.
optimistic thing is it's going to get better, and most people it does.
Right.
It just takes a while. So
Yeah.
good luck. Next question is from Paula G. And
Paula.
Paula is 38.
Glad you gave us a note.
Yep.
We'll help ya.
She's female. The question is wrist pain when I try to put any weight on them or lift something with weight.
Okay.
May not always be right at the time, but it could be shortly after.
Okay.
She had an ultrasound, but carpal tunnel was ruled out after nerve testing. Suggestions or recommendations to help strengthen. Well, first off, I wouldn't say necessarily we need to strengthen. One, we need to calm it down. For some reason, it's irritated. So
Right.
you could try, they sell braces at just general, drugstores and stuff like that.
Cross over the counter.
Yeah.
Nothing fancy.
Yeah, if you're going to be using your wrist a lot for something, for some activity, I'd maybe wear the wrist brace during then. I wouldn't
Yeah.
wear it all the time.
No, if it's the activity and you're going to do something for a couple hours and it's going to irritate your wrist, put the brace on while you do the activity so that when you're done with that, it doesn't have all flared up for the next day or whatever.
Right, and also you don't want to weaken the wrist. I'm not really worried about strengthening it. Brad's going to show you a couple exercises that might help mobilize the wrist a little bit and might make it feel better.
So before you do these activities, that the weight bearing, the pushing, the pulling, this simple range of motion exercise could be very helpful. And simply, if this is your wrist, down like this and up like this. And, it's like you're waving by with a stationary forearm. And do that 5 to 10 repetitions. Mine just cracked right now. And you can also add a little overpressure if it's not painful, if it feels like a good stretch. Not hard, just gentle overpressure, okay? And then you can make some circles. I usually do this with a gentle fist. Go clockwise, 5 to 10 reps, counterclockwise. And then this last one I finish out with, take your other hand, grasp over the top, the back of your palm here, just gentle grasp there around just like that so the wrist is here. Now, Mike's going to zoom in on this. I'm going to put some traction, and otherwise this hand stays stationary. I'm going to pull this way while I keep this hand and forearm very relaxed. No muscle contraction in there, and I'm going to pull. That distracts the wrist joint. I'm not going to pull real hard, just a gentle pull, hold it, and then rotate your wrist, but stabilize the hand so you can see, is that coming in, Mike? And then this should feel good. If it develops any pain, don't do it. It should feel like a good motion, or when it starts out, it feels stiff. After a few repetitions, it feels better. That's gold. That's what you want to do.
I think it's an awesome exercise. I don't know if you developed it, Brad, but it's the first time I've seen it.
Well, of course, Bob. I'm going to see if we can get it panned.
Yeah.
No, I don't know. I know I really literally do this on myself because I got a
Sure.
stiff right hand. and it start working really well. And it's like, well, I want to share this. you
Yeah,
know.
but I think it's a great idea. So give that a try and give us a comment. Let us know if it worked out
Yep.
for you.
Good
So,
luck.
Good luck.
Thanks for coming.
All right, our next question is from Sue A. How do you do, Sue? That's one of my favorite songs, My name is Sue.
Johnny Cash?
Cash,
Johnny Cash. Sorry, Sue.
Yeah, I'm sorry, Sue.
I hope you appreciate our
Let's
humor.
go to her question here. She has chronic tendonitis in both arms and elbows. She has numbness on the left side of her body due to multiple sclerosis, especially the leg. She has difficulty walking without a limp. She puts weight on her wrists, and it hurts her wrist using a cane.
Sure.
How can I minimize the pain? What different type of cane handles or trekking poles would different types of cane handles or trekking poles make any difference on the biomechanics of the hand? Or are there exercises for mitigating the pain in the right hand and arm? Balance is becoming more of an issue. Thanks in advance for the tips. Sue, trying to be MS Warrior. You are an MS Warrior.
Right.
So you are the woman.
That's right.
So,
You're doing outstanding.
Yeah.
And I think we have some suggestions that will be helpful depending on what you've heard so far. But the very simplest thing we've done with people is if you have a handle like this, is simply take a cloth, a rag, a washcloth, wrap it around and put some tape on it just for some cushion, and try that just to spread the forces out on your palm. If that works well and you want to get something more permanent,
they sell them.
They sell actually things that go over this,
Slip over the top,
slip
yeah.
over the top. Or I've seen some really nice ergonomically shaped handles on the cane, and you can just tell it spreads out. I wish I had one here, but since we had to move down in the basement, we don't have all of our canes here. But you can tell it's an ergo handle, they may call it, and it spreads out the forces throughout your palm. It can make a big difference. We have a couple other options too.
If your hand just can't tolerate it, there are what is called platform crutches or platform canes. Mike, our camera person and editor, is going to put a picture of one up right now.
Yep.
But you can see that you'll take the forces then on the forearm.
Right.
It'll be spread along there. And you can even put those on a walker too. So on both sides, if your balance is getting worse, as she had mentioned, so you can lean on that on both sides, and because you don't want to fall. I mean, that could be disastrous.
Right.
So you can also use two canes. With platform canes.
Right.
The other thing is there's also a cane called a LOFSTRAND, LOFSTRAND.
I've used them with patients, and I like them.
Yeah.
And it depends on the individual.
Yeah. They don't take as much stress off the wrist as a platform does. One of those options should give you some relief.
I think so.
And keep being a warrior there.
That's right. Keep it going strong. We appreciate it.
Okay, our next question is from ALLYSON D.
Okay.
That's the last initial.
Alice.
Yep.
Is that with one L or two?
Two L's.
Two L's.
It's a Y in it too. ALLYSON.
Oh, how nice.
Really unusual.
I like that.
She's all in. Okay, her question. Excellent. Yay. I have spasms, lumps in my forearms, especially the right one. I get a sharp pulling tight pain on the medial aspect of the right elbow, which I presume is tennis elbow, tendonitis. If she means by medial, this is medial, and that's usually golfer's elbow. We're wondering if she doesn't have tennis elbow, because she gets it a lot from gardening and stuff like that.
Right. So we'll help you out one way or another.
Yeah.
We'll get this thing down.
We'd like some stretches. Self-massage is really not helpful. Does use computer at work, mostly typing. Desk area, not ergonomic, so forever readjusting my posture. Desk about 2 centimeters too high, computer way too low. So we need to address those issues too. But why don't you talk about first, Brad, what she could try for the...
Okay. If your pain is, and the chances are, because most people have tennis elbow, like you had mentioned, which means it'd be in this area where you talk about those muscle knots, and it sounds like you're massaging, which is a good thing. And if it's not working, this is something that we found very helpful. It's called a strain, counter strain, or positional release. And so what you're going to do is, if this is the painful arm, right in here, you're feeling that, take your hand.
You'd probably want a pillow, right, Brad?
Yeah, it probably would be. Oh, we got one here.
Yeah.
Well, we're set up today.
Yeah, well, we're good.
You can use a pillow. You can put it like this so you can rest and relax this arm. Takes this hand, push it back like this, and then rotate out this way. At that point, this area, you're putting those muscles at maximum slack or they're relaxed as possible, and you're going to be relaxed. Don't do this when there's people around, so you can really think about relaxing. Rotate it this way, and you can rotate it wherever it feels the best. Once you get to a point where it feels like, oh, it's relaxed, I can feel it, no pain, then you're going to hit the clock or look at a timer for 90 seconds and just hang out and relax. 90 seconds. When the 90 seconds, you can go a little longer if it feels good. At 90
not less than 90 seconds.
Right. That's very critical. Then after that 90 second or up to 120 seconds, then you just relax and let it come back slowly. You can do a gentle massage to the area, work it slowly, and then go back to the, I did this for the first time within the last few months, and I was amazed at how well it worked. I used to do the massage.
How often can you do it?
Oh, you can do that.
Throughout the day?
Yep, 2-3 times a day at least. Although I found with mine, I did it and I actually forgot about it. I didn't have to do it anymore.
Wow.
And I did it a couple times.
That's quite a testimonial. So
hopefully you'll have similar luck. We've got another option that we talked about.
The other option, the computer option, we can't let go. I mean, you really want to make sure there's two things that you're going to make adjustments. One, you don't want the arms forward like this. This arm should be vertical, completely vertical. It shouldn't be forward like this. If it is, you're putting stress on the entire arm and hand. So this is the way, and the keyboard should be level or even a little bit lower.
Right.
It could even be on your lap. We sometimes have people use those lap trays and put the keyboard on there, or some people put the keyboard on their lap.
And really, if you are having problems with the wire, if you get a wireless keyboard so you don't have to worry about that getting in the way, they don't cost that much, and they can be really helpful, particularly if you're using, you probably don't have a laptop, it didn't sound like, but.
No, it's possible. She says the screen is way too low.
Yeah.
That's got to be put up too.
Yeah, it's a big one.
Absolutely. You got to have it up to the point.
If this is the screen, and Bob is sitting here.
My eyes are going through, and I'm hitting maybe the center to the top of the screen.
Exactly.
You can just take books. Everybody's got books. Just raise it up.
Books or boxes, or have someone hold it if you really.
Yeah, that's right.
Just kidding.
So you're gonna have those could be causing your pain more than anything. And when you're doing garden work and doing a lot of squeezing with the hand, you're going to have to break that up a little bit, maybe not do it all in one day.
Right.
I know it's easy to
but,
fall into that.
You could have this success with this and have it feel good, but then if you go to your computer with poor ergonomics, it's just going to re-irritate it.
Right back up again.
It's a snowball, anything. So you got some wonderful questions. We really think this is treatable just by working with what we talked about.
Good luck, Allison.
Alice, good luck, and we hope things go well with your gardening and the flowers bloom and everything turns just beautiful.
You said enough?
What?
Have you said enough?
Well, it's just trying to lighten things up a little bit,
Thanks.
trying to put things on.
Thanks for watching.